Hi, my name is Morgan, and today I'll be showing you how to perform wound care and how to get a culture, and then also how to be putting on an ACE wrap. And now my partner Michelle is going to scan the room. And then I have my provided orders right here. So before I can enter my patient's room, I'm going to look at that. And so we have Shirley Kosh. She's a 33-year-old female. Okay, her date of birth is 4/3/1987, and it's currently November 13th, 2022, and then at 9 a.m., which is currently 8:30, so that's perfect. She has scheduled a daily dressing of wound with wet to dry dressing as needed. Obtain a specimen for wound culture and apply ACE wrap on lower left extremity. Okay, perfect. So I've already talked to the nurse when we switched, and she already gave Shirley her pain meds. So about right now is the correct time to give them. And then I already went in and assessed Shirley right before this, and she told me that her pain was a 2 on a scale of 1 to 10. So that's good. So I know that she won't feel any discomfort. So I have my supplies here, and I've looked at my order, so I'm ready to enter in the patient's room. Hi, Shirley. How are you doing? Okay. Can I just have you verify your name and date of birth for me? Okay. Shirley Kosh, 4/3/1987. Perfect. Okay. And then Shirley, do you have any allergies by chance? Okay, penicillin and furosemide. Okay. Thank you. Okay, Shirley. So I'm Morgan. I'm going to be doing your wound care today. Do you have any questions about what we're going to be doing? No? The provider went over it? Okay. You've had your wound cleaned multiple times. Okay. So just let me know if at any time it's tender or anything like that. Okay, Shirley? Okay. So are you ready to get started? Okay, perfect. So I'm just going to be moving this to give Shirley as much privacy. We'll still be able to see the wound. So I'm going to do hand hygiene, and then I'm just going to put on my gloves right now. I would put them on right as I start, but for video purposes, I'll just put them on right now so I can get my things together. Okay, so what I'm going to do first is I'm going to assess the wound. So the outside dressing, there's no, seems to be intact and clean. There seems to be no shadowing, so that is good. So I would document that, and I'm just going to have you lift up your leg, okay, Shirley? Oh, thank you. Perfect. Okay, Shirley, how are you doing? Doing good? Okay, perfect. And then I'm going to be getting my stuff ready. There we go. And then be getting my bag ready as well. Okay, so I would have performed hand hygiene and put on new gloves. And so I'm going to be taking off Shirley's abdominal pad. Okay. Okay, so then from here, I'm seeing some discharge, some fluids. I see some yellow and red. Okay, so I'd make note of that. And I do see a little bit of fluid and drainage, so I'd make note of that. But other than that, that's normal, so I can put that in there. And then I would take off my gloves, perform hand hygiene, and put on new gloves. And then I'm going to assess Shirley's wound. So I see some sloughing, some red. I don't really see much a scar. It seems that it's pink and it's healthy. Shirley does tell me it's a little bit tender, but not really that bad. So I'm just going to get all my supplies ready. So, you get this. Okay, perfect. And then for today, I'm going to be irrigating Shirley's wound. So because I looked at her wound and for better pressure, I'm gonna actually not be using this. I'm gonna be using my 30 ml syringe. And for this demo, our room didn't have a catheter tip, but for this, I'll know that there's one on it. So then for this, I'm gonna, have my saline water. So what I'm gonna be doing is I'm gonna be lipping this. And then, so that means I'm just gonna be taking, and then that would be poured in here. And then I'm gonna be grabbing this, and I'm gonna be pulling up 30 mils. Okay, perfect. And then I'm gonna be going from side to side all the way down. And then we make sure that's good. And then I have my gauze here just for if there's any spillage or leakage. And I'm gonna hold this about 2 inches away. So I'm gonna keep going. And then I see some color in the drainage. So I'm gonna come back and I would get more of my 30 mils of saline. Perfect. Okay, and then I'm gonna go with being 2 inches above so there's no spillage or leakage. And then I see clear liquid, so I know that that's good. So I dispose of this. And then I take off my gloves and put new ones on. And then what I'm gonna do now is I'm just gonna dab this just so that when I take my culture, it's not too wet or give any false results. So I've done that. So then I document that and how she tolerated it. And now I'm gonna be moving on to my culture. So I would have changed my gloves, performed hand hygiene. And now that I see it says obtain a specimen for culture room. So that's good, okay. And then I'm gonna make sure for this that I'll get a nice pink area and none of this sloughing. So pull that, and then I'm just gonna roll this. And then once I get that, I'm gonna put it back in here. I would have Shirley's name, date, specimen, my initials, the time, and then I'm gonna have my biohazard bag. And I would put this in here and make sure to have one of my CNAs or myself get this to the lab as soon as possible. And so I've done that, and then I would dispose of that how I need to. And then from there, since I've done that, I would clean my gloves, or I'd take off my gloves, I'd clean my hands and perform hand hygiene. And then now I'm just gonna be measuring. So I'd make sure not to press on Shirley's wound, but I've got 15. And then by 15. Yep, 15. Okay, perfect. So I got that. I would document the size. So I document that. I would change my gloves. So there's that. Let me just put this out of the way. Okay, perfect. So then after I've done that, then I would go and have my swab sticks. So I have these, and then I'm just gonna rip this open. And then I'm just gonna roll, and then I would dispose of this. And then dispose of this all the way down. And I would use as many swabs as I needed. So I'm done with that. So I'm just gonna put my, get my stuff ready. Okay, perfect. And then now that I've done that, I would change my gloves and perform hand hygiene. And then I'm gonna be lipping this again. And then I'm gonna be grabbing over here. And I'm gonna be pouring some saline on that. I'd make sure to get all the excess. And then I'd be fluffing it and make sure to get it only where the dead skin is. And if I needed to use multiple of these, I would. Okay, so I got that, so perfect. And then for Shirley's, I would probably put another one to cover it fully. but since I have limited gauze, I'm just gonna put that one. And then on this, I would have, that one would be wet, and then I'd be placing 2 other gauze on top. How are you doing, Shirley? You're doing good? Okay. And then I would get my abdominal pad, and I would place that on, and then I'll just move that over, and then I've got my tape. And I'm gonna make sure to tape about 1 inch on each side, so it's not so much where the circulation, but not too little where Shirley can't feel, or it moves off, sorry. Okay, perfect. Tape that. Perfect. There we go. Okay, perfect. Okay. So Shirley, how are you doing? You're doing good? Okay, I would take off my gloves. I'd make sure all my supplies get to where they need to be. Let's see. Okay, so I've got that. So I would take off my gloves. I'd make sure Shirley's doing okay. I would put everything away per policy orders. So Shirley, I'm just gonna be lifting this up. Perfect. Okay. And then I'll be putting this away. Okay. So I'm done with that. I would document that, and I document the time and date and how Shirley tolerated it and the characteristics of the wound. And so now I'm gonna come back and I'll have my gloves off, but for this I'll just leave them on. So for this I'm gonna apply an ACE wrap on the lower left extremity. So perfect. So I'm gonna come over here. How are you doing, Shirley? Good? Okay. And I'm just gonna try and expose all that I need to for Shirley. Okay. There's Shirley. And then I'm gonna be taking this previous one off. Okay. And when I put this new one on for Shirley, on the mannequin it's kind of hard, but for a real person, I'm gonna make sure there are no wrinkles or anything, because I don't want to create any pressure or anything like that and discomfort. Okay, so I've got that. I would have performed hand hygiene before doing this. And that would have become nicer. Okay, perfect. And then I'm just gonna grab my tape while I think of it, sorry. Just so it stays on better for the demo. Okay. Okay, perfect. Find that. And then I'm just gonna make it like that so it's easier for me. I would make sure that didn't happen, and I would try and just pull. And then I'm gonna make sure to not have any wrinkles for Shirley, but as I said, on the mannequin it's kind of tough. So I'd make sure to get all these creases out. And I would make sure to get this back here. I'm going to re-pull that up. And then I'm going to tape this. grab my tape. And then I would tape this onto Shirley. And make sure not to do that too tight. So there we go. And then this would obviously get covered. It's kind of hard to get perfect with these. Oh, there's my tape again. Okay. There we go. Okay, perfect. So that's my ace wrap. And then for this, after I do this, I would make sure Shirley has a good range of motion in her foot. I would check her pedal pulses. I would check her capillary refill. Make sure she's doing all right. Are you still doing all right, Shirley? Okay, sounds good. So I got that. I would document I did that. I would make sure Shirley has her call light within reach. I would provide privacy. I would throw away all my supplies that I need to, and I would take off my gloves, or I wouldn't have them, so I'd perform hand hygiene and then I'd leave the room. Thank you.